Ever wondered why hypertension, often known as the silent killer, is such a significant concern worldwide? Here's why. Hypertension affects 1 billion people globally from all walks of life. It leads to severe health complications and is a primary cause of numerous deaths. However, it does not show symptoms, hence the name silent killer. With lifestyle changes and regular checkups, it's manageable. To recap, hypertension is a global issue affecting 1 billion people worldwide. However, with lifestyle modifications and regular checkups, it's a condition that can be managed effectively. Our discussion on hypertension would be incomplete without a clear understanding of what it actually is. According to the Joint National Committee, JNC, on prevention, detection, evaluation, and treatment of high blood pressure, hypertension is defined as a systolic blood pressure of 130 mmHg or higher, or a diastolic blood pressure of 80 mmHg or higher. These numbers are based on the average of 2 or more accurate blood pressure measurements taken during 2 or more contacts with a healthcare provider. So what do these numbers mean? Well, the systolic pressure, the first number, measures the pressure in your arteries when your heart beats. The diastolic pressure, the second number, measures the pressure in your arteries when your heart rests between beats. When these numbers consistently stay high, you're in the hypertension zone. Now, this might sound a bit technical, but understanding these basics can go a long way in helping manage or even prevent hypertension. Remember, knowledge is power, especially when it comes to our health. In the next scene, we'll discuss the importance of awareness and prevention in the face of this silent killer. Let's delve deeper into the classification of hypertension according to the Joint National Committee, JNC. The JNC has classified hypertension into stages based on the blood pressure measurements we discussed earlier. Stage 1 hypertension is when your systolic pressure ranges from 130 to 139 mmHg, or your diastolic pressure ranges from 80 to 89 mmHg. Stage 2 hypertension is when your systolic pressure is 140 mmHg or higher, or your diastolic pressure is 90 mmHg or higher. There's also a category called hypertensive crisis, which is when your systolic pressure exceeds 180 mmHg, or your diastolic pressure exceeds 120 mmHg. This is a medical emergency and immediate action is necessary. Why is it important to know these stages? Well, they help healthcare providers determine the severity of your hypertension and what treatment approach to take. It also underscores the need for regular monitoring. If you know your stage, you can make the necessary lifestyle changes and take the appropriate medical steps to manage your hypertension and even potentially reverse it. Understanding the stages of hypertension can help in better management and treatment of the condition. With this knowledge, you're better equipped to take charge of your health and make informed decisions. So, keep monitoring, stay informed, and let's move to the next scene where we'll discuss the importance of awareness and prevention. Now that we know the classification of hypertension, let's discuss how it's diagnosed. The diagnosis of hypertension typically starts with blood pressure readings. A device called a sphygmomanometer is used to measure your blood pressure. The reading consists of 2 numbers. The systolic pressure, which is the force of blood against the artery walls during the heartbeat, and the diastolic pressure, which is the force when the heart is at rest between beats. The readings are measured in millimeters of mercury, abbreviated as mmHg. However, a single reading is not enough to diagnose hypertension. Healthcare providers typically take multiple readings at different times to confirm a diagnosis. This is because various factors such as stress, caffeine, and physical activity can temporarily increase your blood pressure. Therefore, a single high reading doesn't necessarily mean you have hypertension. In addition, your healthcare provider may recommend other tests such as blood tests, urine tests, and an electrocardiogram (EKG) to check for signs of heart disease. These tests can provide more information about your overall health and help determine the best treatment approach if you're diagnosed with hypertension. Diagnosing hypertension is a straightforward process, but it requires multiple readings and possibly other tests to confirm. If you're diagnosed with hypertension, it's important to understand what this means and how it can be managed. In the next scene, we will discuss the different types of hypertension, which will help you understand your diagnosis and treatment plan better. Stay tuned. Before we delve into the significance of awareness and prevention, Let's explore the classification of hypertension as per the guidelines of the Joint National Committee, JNC. Hypertension is not a singular condition, but is classified into two main categories based on its causes. Firstly, we have essential or primary hypertension. This version has no identifiable root cause and tends to develop progressively over a number of years. This category accounts for approximately 90 to 95% of all cases of hypertension. Factors such as age, genetic history, ethnicity, dietary habits, lack of physical activity, and obesity can increase the likelihood of developing hypertension. On the other hand, we have secondary hypertension. This category is triggered by an underlying medical condition and usually manifests abruptly. It is typically more severe than primary hypertension and can be provoked by conditions like renal disease, adrenal gland tumors, certain congenital heart deformities, and specific medications such as contraceptive pills, cold remedies, decongestants, over-the-counter analgesics, and some prescribed drugs. Understanding these classifications of hypertension can assist you in better comprehending your diagnosis and treatment options. It's crucial to gain a thorough understanding of your condition, as the type of hypertension you have can directly impact your treatment approach. Now that we've comprehensively covered the JNC classifications, we can transition into the significance of awareness and prevention. Before we discuss the importance of awareness and prevention, let's understand the types of hypertension. It's crucial to delve into the numerous risk factors associated with it. Just like any other health condition, hypertension doesn't occur in a vacuum. There are many factors that can escalate your chances developing this condition. Firstly, age plays a substantial role. As we grow older, the risk of hypertension elevates. Secondly, race is another influential factor. Hypertension is particularly prevalent among people of African heritage. Furthermore, family history plays a crucial role. If your parents or grandparents suffered from hypertension, your chances of having it are increased. Next, lifestyle factors come into the picture. Being overweight or obese, for instance, augments the pressure on your artery walls because your body requires more blood to supply oxygen and nutrients to your tissues. Lack of physical activity can also usher in higher heart rates, boosting the risk of hypertension. Moreover, tobacco use can inflict significant damage to your artery walls due to the deleterious chemicals it contains. Dietary factors also contribute. Consuming an excessive amount of salt or sodium in your diet can cause your body to retain fluid, hence increasing blood pressure, while too little potassium can disrupt the sodium balance in your cells. Drinking excess alcohol can gradually impair your heart, leading to high blood pressure. Lastly, elevated levels of stress can cause a temporary spike in blood pressure. Being cognizant of these risk factors can aid you in making lifestyle alterations to prevent or manage hypertension. Remember, prevention is indeed superior to cure. Now that we understand the types of hypertension and their risk factors, let's move on to the importance of awareness and prevention. Now that we understand the types of hypertension, it's crucial to delve into the risk factors associated with it. Understanding the different medications that can be prescribed to manage and control high blood pressure is a part of this. Let's explore further into the primary classes of these antihypertensive drugs. 1. Diuretics. Like hydrochlorothiazide, these medications aid your kidneys in eliminating sodium in water, thereby decreasing blood volume. This process assists in lowering your blood pressure. However, they can provoke side effects such as increased urination, electrolyte imbalance, and dizziness. 2. Beta blockers. Drugs such as metoprolol work to reduce the load on your heart and widen your blood vessels. This results in your heart beating at a slower rate and with less force, which into lower blood pressure. Side effects can include fatigue, cold hands and feet, and a slower heartbeat. 3. ACE inhibitors. Medicines like lisinopril aid in relaxing your blood vessels by curbing the formation of a natural body chemical that blood vessels. This also helps to lower blood pressure. However, they can lead to side effects like a dry cough, high potassium levels, and dizziness. 4. Calcium channel blockers. These drugs function in two ways. They either assist in relaxing the muscles of your blood vessels, or they slow down the heart rate. Both actions can result in lower blood pressure. 5. Renin inhibitors. These drugs halt the production of renin, an enzyme produced by your kidneys that starts a series of chemical steps that increase blood pressure. Understanding the diverse types of antihypertensive drugs can boost your knowledge of your treatment plan. Always remember to take your medications as directed by your healthcare provider. This knowledge is a key component of managing hypertension and maintaining a balanced lifestyle. While we're on the topic of antihypertensive drugs, it's crucial to understand drug interactions. These interactions can influence how your medications work or escalate your risk for serious side effects. 1. First, let's talk about antihypertensive drugs and non-steroidal anti-inflammatory drugs, or NSAIDs. NSAIDs can decrease the effectiveness of your antihypertensive drugs, rendering them less powerful in controlling your blood pressure. 1. Next, certain antidepressants can interact with your antihypertensive medication, potentially causing an unsafe drop in blood pressure. It's vital to be aware of this, especially if you're prescribed both types of medication. 1. It's absolutely essential to discuss with your healthcare provider about all the medications you're taking, including over-the-counter drugs and supplements. This will help your doctor to prescribe the best treatment plan for you and avoid any harmful interactions. Understanding potential drug interactions can help prevent complications and ensure your treatment plan is effective. Remember, knowledge is power, especially when it comes to your health. Stay informed, stay safe. So, we've taken a look at the types and risk factors of hypertension. Now it's crucial to delve into the classification of antihypertensive drugs. These are integral to managing this silent killer. While hypertension can lurk unnoticed, it doesn't have to be deadly. Always stay well informed, make healthy lifestyle decisions, and don't forget the importance of regular medical checkups to keep hypertension at a safe distance. It's a worldwide health concern. But together, through awareness, prevention, and efficient management, we can all play a part in lessening its impact. Let's not undermine the potency of knowledge when it comes to our health. Indeed, it's always better to prevent than to cure. So that concludes our comprehensive exploration of hypertension for today. Do remember, hypertension may be a silent killer, but it doesn't have to be. Keep watching for more compelling health topics that will not only keep you informed, but also empowered.